from the conversation we had with Wajala, just looking at the manifesto, I did go into the details, but I just spent a few minutes, just flipped through. I just thought maybe if I could just share with you some of the success stories that have come from innovative activities at KEMRI. Maybe this could generate, some discussion. And well, KEMRI, or the Kenyan Medical Research Institute, is actually a state corporation which was established about now 30 years ago. It was established at the breakdown of the East African community. So through the diffusion of the Science and Technology Act, each country came up with their own research institutions, and that's how KEMRI came up. And the main goal of KEMRI is to conduct biomedical research, and basically what we are interested in are diseases that are of national and international importance. As you're all aware, diseases do not choose boundaries. Malaria is everywhere all over the world. So we do not just limit ourselves to what is of national importance. And the examples of the diseases that we invest a lot of time and energy on, and I must say this is together with our collaborative and institutions and partnerships like Welcome Trust, where it is working. It's malaria, of course, a lot, as you all know. Malaria accounts for the highest rates of morbidity in the country. HIV, AIDS, TB, microbial, and other parasitic diseases. This includes leprosy, other parasitic diseases like schistosomiasis. We also look at other general public health issues and traditional medicine as well. And actually, that's where I'm coming from. And of course, capacity building. KEMRI has a collaborative partnership with Kenyan University of Technology, where they are training postgraduate students in infectious diseases and tropical medicine. Well, I'll just take you very briefly on some of the fairly few success stories. And as I said, these are normally collaborative partnerships, so I don't want Ruth to go and say, So one of the very good success story that we are so proud of is that KEMRI, together with our collaborative partners like JICA, were able to come up with blood safety testing kits for HIV, AIDS, and hepatitis. And they are in the market. Well, they have been adopted by most of the provincial and district hospitals in Kenya, and they have also gone to the region as well. I know countries like Rwanda and Burundi are also making use of them. We also have another success story of a school-based parasite control. This is where the school, students are being treated for parasitic infections, for helminthes, and they have realized that that strategy alone has really increased the school attendance, and in the final analysis has had some economic benefits. Through our research findings, we've also been able to advise the Ministry of Health on advent of drug resistance, particularly in the treatment of malaria. And we have had two drug policy sheets, one in 1987 for the use of chloroquine to sulfur-based antimalarials, and another one in 2006 where we are now using artemether lumefantrine combination. That was very key because at least from our findings, we were able to advise the government on time. Through some other research findings, we've also been able to detect the presence of motor drug resistant and Beijing W type strains of TB in Kenya. And that way we've also been able to advise the Ministry of Health. We've had some policy implementations on that. We've also, the KEMRI was also involved in carrying out, one of the key large-scale trials of impregnated bedrooms, and actually this was together with Welcome Trust. And as there's documented evidence that the rate of malaria infection has come down out of this strategy. We've also been able to carry out some major studies in intermittent preventative treatment of malaria together in collaboration with Welcome Trust. And of course, this also had some benefit, which has been translated even at a community level. Another success story also through collaboration with Welcome Trust is that what they did is that in malaria endemic areas, they realized that the first place where people go to when they have fever is to the shopkeeper in the local, we call them dukas in the villages. So they did some capacity building, to the, or rather they trained the shopkeepers, on how to to diagnose somebody who has fever and to be able to refer them to health institutions. And this actually has had some very major influence on programs in other countries. What I want to say is that this is just a summary. There are so many other, many other strides. And as usual, it's a collaborative effort. But what I wanted to say in summary, and this has actually been mentioned, is that if innovation is going to have an impact on sustainable development, as Ruth has mentioned, it has to be participatory. We realize that when we carry out what motivates our research is probably what we did, and this is normally literature that has been generated from out there. But I think it will need to come down and make it all participatory. Starting with the community down there. If we are going to be coming up with insect-treated deadness, it's important that we involve the community from the word. We don't just want to come up with a product and here we are saying take. In most cases, we realize there generally some local politics, and that does the objective. So I think it's important that we make it all participatory, and let's not just think about the scientists at that level. Let's go down, to the community level. We also need to have very strong linkage to the policy makers, and this should not be limited to our national policy makers. It should also be linked to the regional policy makers and international policy makers as well. We realize that at times while Ruth is saying that we come up with some research findings and they don't go anywhere, it's because the policy makers are not even aware that that kind of a thing was going on. And in most cases, if the research is not being motivated at that level, we take research findings to them and say, well, we already have some other policies, so we realize that we are not getting anywhere. The other thing is that our policies should not be static, they should be dynamic. We realize that, for instance, now out of climate change, there's going to be a lot of changes in health scenarios. For instance, we expect malaria, to all of a sudden be found in places where it was not endemic before. So I think we should not make our policies static, they should be dynamic. The other thing that I thought is crucial is that some of these policies on innovation that we come up with, they have some limitations in the sense that they don't go through the whole value chain. For instance, let's take a good example of what my colleague from Kenyan Medical Research Institute talked about arrow production in the semi-arid areas. Those people they're now looking at other alternatives to livelihoods. But we realize that they're producing arrows, but there are no markets for them because there's no policy to look at the market issues. So I think it's important that we look at the whole value chain. And of course, we should not forget about capacity building, because at the end of the day, if we are talking about innovations at that high level and we are not building capacity downwards, then we are likely to put stumbling blocks. I think that's basically what I want to share with you.